This is extra. Good evening.
Good evening, Mr. Chairman.
State your name, who you represent, your position on the bill, please.
John Lin McCraw. I am President of Texas Trial Lawyers Association. We are against the committee substitute to Senate Bill 2066. We began working early in this session, actually before the session even started, with THA to try to work out their concerns, and we worked diligently in that matter in a way to deal with hospital liens in a way that was both fair to the hospital, to the patients, and to the doctors that they subsequently would see. We were unable to reach any type of agreement. Therefore, we're regrettably against the bill. We still think that there's room to do something here, but the way it currently is, it has only THA's language and nobody else's, and for that reason, we're against the bill. The bill calls for changes to the law on admission. They call it a clarification to the law, but it's really not a clarification. It is a change that allows retroactive application specifically to try to defeat existing lawsuits that are there. There have been a number of lawsuits that have been filed, and I understand there's some testimony on that there will be from the attorneys about fraudulent liens that have been filed by emergency departments in situations in which people have not actually been admitted into hospitals. So this bill is actually intended to deal with those lawsuits. The change to admission. Currently, admission is a term of art. Admission is defined by CMS and Medicare, and it's important because from the very beginning of the lien statute from 1933, we required admission to give the hospital this special right. Okay, and we were doing that to make sure that it only applied to the most serious of injuries and not simply situations in which you're evaluating patients. This change in the law would extend it to any evaluation in the ER, any radiology, any blood test. A patient could actually be seen by a family doctor, for instance, be sent from there to the hospital to get tests done, and the hospital would have a lien where the doctor would not. Those are some of the inequities that would be created in this situation. We have examples after example after example of ER charges that have been, quite literally, extremely high. They would literally exhaust any and all possible recoveries in situations in which the patient is not even hurt bad enough to be admitted into the hospital. Because there needs to be some fairness here, like I said, we are against it. By design, this bill will take money away from patients and other care providers like anesthesiologists, pain management doctors, GPs, physical therapists, and other providers when you have less serious injuries, those that do not require overnight hospitalizations. I'm prepared I've researched the admission, the history of admission. I'm prepared to answer any questions about that you have, but it is not merely a clarification. It is a change in the law.
Mr. Chairman?
Yeah, Representative Collier.
Okay, Mr. McCraw, I want to ask you because you just said you're prepared to ask. We don't need a long dissertation, but I do want to know, how has the word admitted been interpreted or used by the courts?
Well, what's happened in 1933, the 43rd legislature adopted the hospital lien statute, and it's specifically limited to people that were admitted to such hospital, receiving care and treatment and maintenance therein. The way it said, the maintenance therein is really the issue here. They are admitted so they could be maintained. It was more than just evaluation. It's clear in both Section 1 of the bill and Section 5, and it was HB 88 in the 43rd legislature. In Section 5 it says, and to be maintained during such care and treatment, that we're talking about serious injuries. It didn't change from 1933 until 1983. In 1983, when the property code when they codified it in the property code, we see the word admitted to. It must be admitted to the hospital in the 1983 action. The reason that's important is by that time, Medicare had already defined admission in the hospital to require a full admission to the hospital, that it was not merely being seen at the ER or anything like that. Importantly for this body, in 2001, the 77th legislature looked at a bill brought by THA, filed by Senator Lindsey. It's SB 1031. And the change there was they were trying to add in to receive emergency treatment or be admitted to the hospital. Okay, the digest and purpose language indicates that as proposed, that it would attach to the cases in which the individual receives emergency room care but is not actually admitted to the hospital. It says it in the bill analysis itself. It's clear that we have good legislative history here that admission means more than just
being seen
the,
in the. So okay,
yes.
So what I wanted to talk about. So the radiologist. So I wrote down here. So when it says injured individual, well, let's talk about that first. Injured individual. I guess that means somebody injured in a car wreck, not just somebody who fell down and broke their leg.
It depends. If they have a tort claim, it can be
So
more than a car wreck. Yeah, any cause of action. If they have,
does it say that? Because to me, is there another reference to a cause of action type of lien?
The way it's been interpreted, the way it's been used is anytime somebody has a cause of action, that the hospital lien will attach when the patient has actually been admitted.
Okay, but to that cause of action.
Yes.
But it just says now, it says an injured individual, but it doesn't mean that you're going to get a lien just because you came in with an injury.
No, ma'am. The injury is
related to something.
Yeah, the lien has to be attached. It's only going to apply if there's a cause of action. Right.
Okay.
If there's no cause of action, hospital may file a lien in an abundance of caution, but there's nothing for it to attach to.
Okay, so I know I've learned this over time that if you go to the hospital and you get some scans, the radiologist is in the hospital. They may not work for the hospital, but they're there. Mm-hmm. Does this mean that the lien the radiologist would have a lien?
Yes.
Do they have a lien now?
And not only that, no, not unless the person is actually hospitalized. And not only that, the hospital will get a lien for having the machine there that takes the picture that is then sent to the radiologist.
So there would be more liens then.
There'd be a lot more liens, and what it does when you have these liens, what you're doing is you're choosing winners and losers here. You're choosing who gets the money, who has the first bite at the apple. And when doctors can't get the lien, but the hospital can, the hospital will suck all the money up, and there will be nothing there for the continuing care of the patient, particularly in situations in which we're not dealing with devastating injuries. We're dealing with injuries that could be bad, but not bad enough to result in a hospitalization, a hospital stay. Okay,
so now under this particular amendment, if the radiologist who reviews the scans has a bill, then that bill would have a lien because it was allowed to access any department of the hospital?
If it arose out of that, yes, and most of the time it does. It arises out of that because they'll send them to X-ray, they'll send them to CT scans. Right. They're in the hospital, so yes.
But now they don't have a lien? Not
unless the person is admitted into the hospital formally.
And then when you mentioned CT scans, this is what I've known in my own practice where insurance plans will say, well, the hospital should never have done that scan on you. You didn't come in, it wasn't reasonable and necessary. So they refuse to pay, they'll argue about that. So how does that work when there's still a lien on it, but yet the insurance company is saying, I'm not going to pay it because it wasn't reasonable and necessary?
Well, we've actually in my practice, I even run into even a step further in which the hospital will say, I have a lien, therefore I'm not even going to submit it to your health insurance policy. I would rather get the money from you because I think I can get more from you than I can get from the health insurance company. So they try not to even, a lot of times, not to even submit them at all if you have significant injuries and you may have a large policy or something along those lines, or they think that you might. We run into that, that happens fairly commonly. And in fact, I think you're going to hear from a practicing lawyer, the one that has filed some of these fraudulent lien claims about situations just like that.
Okay. So the hospital, so if the health insurance does pay, and if there's a small amount, or your deductible, your $500 deductible, or $2,000, do the hospitals get liens on your deductible amount too, or do they get a lien on the full bill?
They get a lien on the full bill. That's the amount that is that's going to be reasonable and necessary. You're going to have they're going to have to establish reasonableness and necessity. But in practice, the way it works, they put a lien on the full bill, and they put it on the patient to try to determine what's reasonable and necessary. And you understand with how opaque pricing is in the hospitals. It's a virtual impossibility for a lot of patients.
I mean, what if we said that they can only have a lien to the outstanding balance?
The problem still is that does not recognize that.
I'm talking about admitted. To me, when I think of admitted, that means somebody's been admitted to the hospital. They're wheeling you upstairs, basically.
Well, and that's the thing. If they're admitted right now, they have a lien. They have a lien that trumps everybody.
I know,
right
but
now.
this bill changes admitted to mean something different. It means that I just walked into the hospital from a car wreck.
That's right. You could walk in. They're going to run X-rays. You walk out. You walk out, and they're still going to call that admitted under this.
So when the hospital bills. When somebody's, I just want to know if you bill for, and maybe you might not be the right person to ask this question, but I want to know if there's a different code for somebody that has been admitted to the hospital versus somebody who just was seen in the hospital, emergency room. If they use different billing codes.
Yeah, I understand that there is. I'm not an expert in medical billing, but I understand that there's different codes depending upon whether or not you're admitted or not. Because there's different rates of reimbursement for that, and there's higher and lower rates of reimbursement depending upon how it's coded.
So I don't know how we could reconcile this with that code. To me, if there's a different thing, then that means it's being interpreted differently by the health plans.
Well, it's defined differently by Medicare, by CMS, and that becomes again then the basis for those codes being different.
All right, thank you.
Representative Burkett.
Thank you, Mr. Chair. Just a follow-up question to Representative Collier's office. Question. You had talked about if they are admitted, if they are not admitted, this is picking winners and losers, and you mentioned that it would put it in line behind the X-rayist and the doctors, etc. How is it any different if they are admitted?
If they are admitted, the first dollars go to the hospital if they're admitted. There's no cost-sharing provisions in our current law. If there's not enough money to go around, the hospital gets it all. There's nothing left for the doctors. There's nothing left for the patients. There's no cost-sharing in going to get the money. In other words, in pursuing the tort.
So that's the way it currently is?
Yes.
So
for admissions, for full admissions.
All this does is just extend that to receiving services.
All this does.
You just had said that made it different.
No, what this does is this broadens the range of people that are going to have that bite at the first money, and it's going to shrink the amount of money that's available for subsequent treaters. It's going to shrink the amount of money that's available for patients. That's what this bill does. And again, it is a change in the law. It's not just a clarification. It is a change.
But the difference is admitted and received services. So if I received the same services, but I was admitted overnight and let out the next morning, it doesn't do the same on both examples?
If you're admitted, all the charges at the hospital are going to be subject to the lien. If you're not admitted, they are not under current law.
So what I'm saying is if there's a difference of 6 hours and you're admitted overnight for observation and you're released, what's the difference in these two examples as to how the money is dispersed?
Understand that whether you sleep in the hospital or not does not indicate whether you're admitted, because to be admitted you have to have a doctor's order admitting you. You can stay in the ER all night, and that's not considered admission.
I understand that. What I meant by admitted is if you stay overnight for observation and you're released the next morning, you're admitted, are you not?
If you're admitted to the floor, absolutely.
If you're admitted to the floor. So then if you're observed overnight and then you're released, what's the difference between the pecking order of how the money is dispersed with being admitted overnight for observation and not, but basically receiving all of the same services in either instance?
If you're admitted, if you're injured bad enough that your doctor feels that you have to be admitted to be observed, then currently the lien attaches to any services that are applied there. Okay, and you ask for the difference, and the difference is if you merely come in and you are evaluated, you are not admitted, but you are evaluated. Currently, under my understanding of what admission is, under the history here, that's not an admission. You do not get a hospital lien for that. The patient would still owe the medical bills, just like the patient would owe the medical bills for the orthopedic doctor that sees them the next day or the next week or the next month, or the chiropractor or their GP for the injuries. But they don't get they wouldn't get this heightened lien. They would owe it just like they would owe any other debt.
Right, I understand that. I guess my question is clarifying on her question. You had mentioned that this was picking winners and losers.
Yes.
And the hospitals would get theirs, and the doctors wouldn't, the X-ray wouldn't, on and on. But if they're admitted and they stay overnight and they're observed and they're released the next day, there's no difference?
If they're admitted and they come
I understand
the
how
next
it's
day,
working. I'm just talking about the logic.
the
of
lien
the
is going to
answer.
attach only to that under current law.
I understand.
And you know, there have been I've run into a number of folks who say, why do we have hospital liens at all? Because shouldn't the doctors have equal rights to the hospital? And that's a good policy argument, but that's a policy argument for you guys, right?
Exactly.
I'm merely pointing out that part of expanding this, if you're going to expand these services, and part of the thing that I see in my practice is when I have people that are just evaluated, they might be evaluated after a car wreck, and they're going to run CTs on them like, you know, I've had tens of thousands of dollars run in just the ER. Somebody that walks in and walks out an hour and a half later, and we've got a $20,000 or $30,000 bill. They shouldn't get lien for that because they're not hurt bad enough to even be admitted to the hospital.
I think that's kind of covering for themselves because of litigation. But I appreciate your input. Thank you so much.
Oh,
Yeah,
Mr. Chair, I just want to follow
Collier.
up because I think that he was onto something, because what happens now is if you argue over reasonable and necessary for the lien on the CT scan, So say, for instance, they walk in and they do a CT scan and an MRI. And it's like, well, the MRI was done first and then CT scan. And then you've come back out, you know, you're released after that. Then I guess it's the third-party carrier says, you know what, it wasn't necessary for you to have that CT scan, so we're not going to pay for it. Now with the lien, I don't think that you have that option to argue. I don't know if you have the option to argue. It would be up to the hospital to decide whether they want to accept your argument that it wasn't reasonable and necessary, or for the hospital to say, I'm still insisting on full payment because we have a lien. So then there's no room for argument or discussion on what was reasonable and necessary. That's all I'm thinking. Well, that there probably wouldn't be as much.
And there's one other point, Ms. Berger. When you indicated that it might be for fear of litigation and that sort of thing, you already have in the ER the highest protection in law. I mean, it's a gross negligence issue. Simple negligence doesn't get it in the ER. It's gross negligence. It's a very, very high standard. There's no need to do things that are not necessary to fully, you know, to evaluate somebody. There should be no liability question about that.
Representative Burkett.
I would love to have heard our doctors, well, there's Dr. Sheffield, thoughts on that. That's not what I hear from doctors on any kind of basis when I talk to them about their practice, that a lot of their tests, et cetera, are because of the possibility of being sued. So, and I would like to think it's also patient protection as far as to insure things, but I think that's often been part of the makeup of some of the things that are done when we go through. When you go to the doctor on a regular basis, you may have a lot of things that you're a little bit surprised that you're doing, and that's often what I'll hear.
Okay. Representative Guerra.
Thank you for testifying here today. My question is, I think really the issue is the operative word of what is a lien in the sense of who gets priority.
Yes.
Is that not the key here?
That is the key. The lien holder gets priority over everybody.
Okay, so could you explain to us all, if you would, the difference between a situation where there is a lien, a statutory lien, this would be a statutory lien, correct?
Yes.
As opposed to somebody who goes into the hospital, let's say a doctor sends them over there, I've been in a car wreck or whatever, get over to the hospital, x-rays are done, they're released. Does the super lien as the law exists right now, attach?
As long as they are not admitted into the hospital,
Correct. In other words, they were not
then
formally
it
admitted.
should not attach currently.
Okay.
Some of the litigation that this is trying to deal with is founded on situations in which hospitals are filing these emergency room visits as hospital liens, and that's what some of this is about.
So now, if we break it down, the question then becomes, who has? Okay, let's just say as an example, there's X sum of money available from whatever source. Okay, whether there's a lawsuit or not. Let's say that there's X sum of money. And this person does have a right to bring a claim. My question becomes, is this: who exactly who would stand in line first if there's no lien, and if there is a lien, who stands in line first?
If there is a lien,
and I'm talking about other treating physicians who are not employed at the hospital. I'm talking about outside.
Okay.
Okay. Because I think that's where the confusion here is, and that's what I'm trying to understand.
So what happens is the lien, whoever has the lien, the hospital lien, if you have a valid lien, they go first. They get all of their money before anybody else is considered. And if it exhausts the policy, if there's no other money available, there's just no other monies available, they get it all.
All right. Now.
Okay. Now, if there's not a lien.
That's correct.
Okay. If there's not a lien, the patient owes a bill. The money comes in. The patient then can pay how they need to pay to deal with their debts. And the physician in that case would be a general debtor, just like any other debtor that particular patient has.
And also the hospital would be.
Yes, the hospital would be as well.
Okay, so,
absolutely.
So the hospital is standing basically in the same shoes as the doctor would, correct?
That's correct.
If there's no lien, per se.
That's right.
And so basically what this bill does, it expands the definition of admission for the purposes of creating a lien in this situation. Is that not correct?
That's exactly correct.
Okay, that's what I was trying to grasp. And I think that clears it up. Thank you.
Thank you.
Members, any additional questions? Thank you for your testimony. Appreciate it very much.
Thank you, Mr. Chairman.
Thank you.